Are you a crappy partner, crappy wife, crappy husband, crappy mate? This podcast is for you. Give yourself the gift of self-awareness. Learn new skills. Take the time to assess your partnership, marriage, relationship, etc. So how are we going to do this? Start by taking the Crappy Mate quiz. The quiz can be found on our website, www.crappymate.com, on Pinterest, Crappy Mate, Instagram and Facebook, Crappy Mate Podcast. We will dedicate episodes to discussing the quiz topics. In further episodes, we will be exploring common problems, the speed bumps that occur in relationships. Also, we will introduce time-tested skills and helpful hints to enhance your relationship, and we invite you, our listeners, to contribute your thoughts, questions, or concerns regarding relationships. Welcome to the Crappy Mate Podcast. I'm Dr. Richard Vance Barnes, MD. I'm a board-certified general psychiatrist with 25 plus years in psychiatry. I have treated patients in a variety of settings, both inpatient units, outpatient units, partial hospitalization units, as well as detoxification programs and rehabilitation programs. And I've had a private practice for many, many years.
And I'm Barbara Quaid, a marriage and family therapist. I also have over 25 years experience working with families, individuals, and couples. And my life as a therapist has been both humbling and joyful. Before we get started, I'd just like to talk about our disclaimer. The Crappy Mate podcast is designed to be a useful tool to help individuals and couples have happier and healthier relationships. This podcast is not a substitute for individual or couples therapy, and as always, relationships need to be safe. Seek professional help as needed.
The Crappy Mate podcast was developed out of hearing years and years of stories and accounts from patients in therapy about their mates and themselves actually being crappy mates and poorly behaving within the relationship. And so this concept was then developed into a podcast of how can we help people to actually improve upon their relationships.
And so in order to do this, we developed a quiz. And the quiz, we really thought about some concepts that we thought were important in a relationship. And so the Crappy Mate quiz ended up being a 10-question self-scoring assessment that can be found on our Facebook page. And our Facebook page is aptly named the Crappy Mate Podcast. And along with the quiz, you will find a glossary with the terms we used both in the podcast and on the quiz. And this is so we can all be on the same page. Now, to score the quiz, you will read each question carefully and then ask yourself, do I do this almost always, sometimes, or almost never? And when we thought about this, the scoring is like this. Almost always is worth 3 points. Sometimes 2 points. And almost never 1 point. So once you have your total points, you add them up. And a score of 10 to 17 clearly indicates that one needs improvement. A score of 17 to 24, one has a degree of awareness, but improvement can still be beneficial. And a score of 24 to 30, one is aware, insightful, and acting in a positive manner as it pertains to the relationship.
Welcome to the Crappy Mate Podcast. In today's episode, we will be discussing part 2 of what it is like to live with a partner, significant other, mate, etc., who may be suffering from a bipolar disorder. And Barbara, I think that we have a lot to talk about today in terms of what it may be like for that person, that significant other, who is witnessing and watching their partner, their mate, their significant other, their spouse suffer through a bipolar disorder condition of really, we're talking about when they're decompensated and they're really demonstrating the signs and symptoms of bipolar. So let me open this question up to you, Barbara. What do we tell our patients? What do you tell your patients specifically about living with a partner who has the bipolar condition?
Well, that's a really good question because there's so many parts to this question. You're talking about probably the spouse who may not have a relationship with their spouse's medical providers. And so what I would tell the person that comes into the office, and hopefully that is the spouse of the person suffering from bipolar disorder, is I would tell them that they are going to have to be on the lookout for some very specific signs. And these specific signs, like we talked about in the last episode, these could be signs of behaviors like spending, overspending, gambling, hypersexuality, certainly poor judgment. And so the spouse, the partner, is really going to have to muster as much empathy as they can to deal with the situation, especially if their spouse is in the midst of a bipolar manic episode.
And I agree with that 100%. And I guess you would probably agree with this. The first thing, though, they're going to really have to do is learn more about this condition. Would you agree?
Absolutely. And there's so many ways to learn about this. And you had talked about WebMD, which I think is a fabulous source. And in fact, they even have a bipolar disorder guide. So you can just probably go online and download it. And then, of course, in the past, we've talked about NAMI, the National Alliance of Mental Illness. They have classes for people. They certainly have support groups. So there's a lot of support and information from NAMI. And then, of course, the National Institute of Mental Illness also has a lot of information. And if you look online, there's a number of bipolar groups. So all of those are helpful, certainly for the person suffering from this disorder and also for their spouse.
I think that's excellent. And for my purpose, too, I would have to say purpose in terms of people learning. I like also the American Psychiatric Association's website. It has a wealth of information that patients and spouses, significant others can download and they can acquire just a wealth of information around the condition of bipolar disorder. Let me ask you this, Barbara. Why is it so important that we learn about it? And how does that really help us?
Well, I think it helps us because then we can have empathy for that person. We can have empathy for our spouse, our partner, because this disorder is so disorganized and so potentially dangerous.
Yes.
And the behaviors are so outrageous that we could be so angry with our partner, so mistrustful of our partner, that it seems like it could break up the marriage or the partnership. So having that empathy, really trying to be compassionate and empathetic toward our partner is key.
I think that's wonderful. And I always encourage my patients to learn about their conditions, learn about their spouse's conditions. I think it just helps you to really, truly understand them better. And absolutely right, you come away with the notion that it's really not their fault.
Not at all. And I could just give you an example. And this is a little bit of a composite of a number of different patients. But in this case, this is a couple. They're in their early 20s. They have a baby. And the woman suffers from bipolar disorder. And she is doing all kinds of behaviors. First, it started out she wasn't sleeping. Then she was talking all the time. But a little later on, she started having sex with a coworker. She had called up realtors and was going to sell their house without her husband's knowledge. And then she was, late for work, missing work, making all kinds of very, very poor judgments and spending. He comes home, and of course, he's furious. He's really upset and angry and frankly frightened. They have a baby. What happens to the baby? Was she taking care of the baby? So he has to elicit the help from his mother to come into the house and just be there for the baby.
That is a pretty dramatic story or composite that you're describing, but it's real life. And I've had other situations that are quite similar. in terms of the excessive spending or the dangerousness in terms of behaviors or the erratic behaviors that end up causing all sorts of questions around trust, reliability, and fidelity even. So I think you're absolutely right in terms of how you're depicting this and the concerns that people will have. In the scenario that you talked about, the story you talked about, was the husband also really hurt by the fact that she had been sleeping around?
Well, you can imagine he was. He was indeed. Because, of course, he's going to take this personally, that there's something wrong with him. He's not a good partner. What's going on? And that's the problem with this disorder. Things get really confusing because you are not necessarily, he may not be at this point of time recognizing that she's in a manic phase. He might just thinking his marriage is falling apart. And so it's really incumbent upon him to find out what's going on with her. And if she has medical professionals that she sees, hopefully a psychiatrist or a therapist, that he get in touch with them, that he try to figure out what's going on for her.
I think you're bringing up another really, really important valid point, and that is not only learn about the condition, but get involved. Mm-hmm. Be a participant in the treatment plan. Be a participant in the support system that your significant other, your spouse, wife, etc., may need you to be. And I think also when you do get involved, then that's another way of developing your empathy.
You're absolutely right on that. But that can also be a tricky point because let's say the spouse doesn't want you to come to their therapy sessions, or they're in a manic state and they don't want to go to therapy at all. So that's tricky. And then it's the part about, are they being compliant with their medication? This is a spouse that's having to oversee what's going on in the relationship and doing it in a way that's kind and compassionate and not off-putting to the other.
I think that's a very difficult situation when people are decompensated, because one of the things that we can see with the bipolar disorder, which we may not have mentioned in our earlier part 1 podcast, is that, or we did not emphasize, is the fact that when you are decompensated and you are not at your regular state of mind, you could also have psychotic thoughts. You could believe that people are after you, or that you do have an exaggerated sense of grandiosity to the point that it's of a psychotic nature. So it's very tricky and it's very difficult at times to really work with people that may be having a manic episode. But I think the key is that there should be some form of an agreement that people, couples, significant others can come to before people are at a state of decompensation. In other words, while everything is very stable, I would suggest that people decide and talk about, okay, what if this condition starts to go awry and you start to have these other types of symptoms? Can we agree that I will be a part of this and I will help you to get the care that you do need? So I do think that people, partners, spouses, etc., do need to have that sort of an agreement in place prior to things going to a point of needing more care and more treatment.
I agree with that. So having a plan, having your people in place, and what I mean by that is your social network or family members who can come in and take up some of the slack. And then, of course, it's also having a good relationship with your partner's psychiatrist and therapist, because they are the ones that are going to be helping you. They will help you as well as your spouse through this. But of course, this is all for that case where it's a known bipolar disorder. If it's a first manic episode, that's a lot different. It looks different.
It can be quite frightening though. But I think the key with that to remember is that they're not going to be themselves and they're not going to look like themselves. So that may be a clue that something really is wrong at that point. I want to talk about the care that we have to give to ourselves when we are watching and helping and being a part of our partner's condition of bipolar disorder. So, in other words, I really think it's really important that we, as the caring spouse, the caring partner, we develop our own personal boundaries for this condition and what we know that we can tolerate, what we can't tolerate, when we have to reach out for further help. It's very important to have boundaries in terms of this. And one of the keys to this is so that things don't get so out of hand. If you see that your mate, your partner, significant other, your spouse is spending excessively or they're gambling excessively, you want to step in on that. You want to stop that because it's going to have just a detrimental impact on your entire family and your entire world. So I think that boundaries are really important. Now, the other thing that you did talk about, which is really key, is being involved in a treatment plan or being involved in a treatment along with the provider, such as the psychiatrist or the therapist, counselor who is working with your mate, your significant other, your spouse. And I think it's important because they can help you to establish the boundaries that at times that you may not be able to establish. So for instance, let me give our listeners for instance, or an idea of how this comes into play. Now, in the past that I had a patient when I was the medical director for a rather large outpatient treatment center here in Tucson. And what we would do at times, we would have to place people on court-ordered treatment. Now, that is a boundary which is established by providers, by the system that helps people to maintain their functioning. And in particular, it's a way of just establishing an external boundary that says, okay, we have to have a certain treatment plan in place. You have to follow a certain treatment plan. You have to maintain your care. So I think that it's important to be collaborative with your treatment providers or your spouse's treatment providers in particular, so that you can have these boundaries that will help the patient, help your significant other maintain their health.
Dr. B, you bring up a number of really good points there. And I think when you collaborate with your spouse and with their providers, one of the things that you're getting is some support yourself, because you need that support. You need to know that you're not isolated, that there's not a stigma around this. This isn't your spouse's fault, that this is a real disorder, and it's a dangerous disorder, or could be. And I think it allows us to have more compassion for ourselves and our own feelings, as well as compassion for our mate. And all of those are really, really important. And then communication. Communicating certainly with your spouse about what goes on for them. They don't really understand what's going on at any given moment. They lack the ability to really see what reality is at any given moment that when they're in the midst of this.
You bring up a very important point, and I think the point to that more specifically is that, in a bipolar disorder, they lack insight. They really do. They don't understand quite often how they're acting inappropriately. Or, more to the point, many of my patients who have been manic have expressed how they love to feel that energy and that excessive drive, and that they can do so much and that they don't have to sleep. But it's a very dangerous situation, but they lack the insight to see how dangerous it can be. So I think having that spouse, that significant other, that partner who can point out, you'd spent a little bit too much money and you've been shopping quite often. What do you think's going on there? I think that it's important that they have that partner who can help to impart some of that insight that they are actually lacking. And it is a part of the condition as a whole. People that have bipolar disorder will quite often lack their insight into when they are becoming destabilized.
They really are. And there are some things that you can see. If you start to see that speech is really, really rapid and high and nonstop, then you know that it's pressured. You know that something's going on. It's maybe the beginning of a truly manic state. So look out for those signs. And like you said, gambling, hypersexuality, other kinds of behaviors that are not typical for your spouse. And so if you can have that communication where you can say to the other, listen, this is what I'm seeing. I just want to be helpful to you. Is this helpful?
I think those are wonderful, wonderful ideas and tips for people. I try to teach my people to look out and monitor sleep, because sleep patterns to me are usually the first, in my clinical experience, they're the first things that we will notice and that are so disruptive to our mood states and our functioning, that's a strong sign that something may be going wrong. And we know that most people, when they are manic, in the manic phase of bipolar disorder, they're not sleeping hardly at all. They'll go for several days not sleeping, or sleeping only a short period of time and feeling like they're rested and energized. And so sleep is a really important thing. Now, I just want to get back to a little bit in terms of the self-care as the partner watching your mate have these signs and symptoms of decompensation with the bipolar disorder. I think self-care is of utmost importance.
Totally. And I think during stable times, it's important to have something that you do for yourself, maybe an exercise program, having friends, socializing, really taking care of yourself when you can. When your spouse is in the middle of an episode, you still need that same kind of self-care. But you also want to reach out to others. And that might be to family members, that might be to a support system that you have, and friends. Really, self-care is really very, very important. And to remember that this hopefully is just a transitory thing, and that your spouse can get back to a better place.
Yeah, I think, Barbara, two other ideas that really come to mind, and I've seen this in the past with my patients who are dealing with their mates being decompensated with the bipolar disorder. They've gotten into therapy for themselves. And that's been just a wonderful support for them to maintain their strength as they are taking care of their mate. The other thing that I think that we have to shed some light on is the fact that I really feel like faith at this point comes into play as well, and just a wonderful support system for anyone who does have faith and who can use it in a time where their mate is not doing so well and is decompensated. So we should not lose sight of that as being just a wonderful support for people. And I think it's a necessary support during this crucial time while they're watching their mate not do so well.
Absolutely. Lean into your faith.
Yes, absolutely.
So today I have a number of helpful hints for you. And the first one is, number 1, learn about the bipolar disorder. And number 2, the ways to do that is through NAMI, which is the National Alliance on Mental Illness, the American Psychiatric Association, WebMD, and also NIMH, which is the National Institute of Mental Health. And also there are a number of resources online for bipolar disorder. Number 3, recognize that as a spouse, you will need to be an active member of your partner's health team. So be aware of that and be ready to do that. And number 4, muster all your best empathy and compassion. Remember, your partner did not ask for this, and it's not their fault. Number 5, please remember your own self-care, and that's physical, emotional, spiritual. Self-care is an important way to keep you healthy through all of this and to keep you sane. Number 6, plan for a manic episode. This is really just looking at what might happen and what you need to do. And number 7, build a support system. Now, your support system can be anybody. That's family, friends, coworkers, your spiritual guides, whoever it is. But really build a system for yourself and for your partner. This is going to help you get through most anything.
Well, thank you, listeners, for tuning in today to the Crappy Mate podcast. This has been part 2 of living with a partner, significant other, whom may have bipolar disorder. I would say please take the helpful hints to heart. And as always, thank you for tuning in. And if there's questions, concerns, comments, please feel free to write in. Thank you. In closing the podcast today, I just want to remind our listeners of our disclaimer. The Crappy Mate podcast is designed to be a useful tool to help individuals and couples have happier and healthier relationships. This podcast is not a substitute for individual or couples therapy. And as always, relationships need to be safe. Seek professional help as needed.
Thank you for listening to the Crappy Mate podcast. We invite you to submit comments, questions, and/or concerns about today's podcast, or give us feedback on relationship topics you'd like to hear covered. We encourage you to try our helpful hints. Give these a go, try them on for size. Remember, you can follow us on our Facebook and Instagram pages under the Crappy Mate podcast. Our website is www.crappymate.com. And please be sure to subscribe. Thank you for listening.